I love my cat Bear. How do I keep her healthy?
I'm Jonathan Turetsky. I've been a practicing veterinarian for 25 years. We're at the veterinary clinic of East Hampton, New York. This cat Dutch was found stray about 2 years ago, and because he'd been an outdoor cat with unknown history, when we brought him in initially, we did blood tests to check for feline leukemia virus, feline immunodeficiency virus, tested his stool, dewormed him, assumed he had no previous immunizations, vaccinated him against rabies, feline leukemia virus, respiratory viruses, feline herpes virus, Kalichi virus. Depending on the cat's lifestyle, whether the cat does go outdoors, whether the cat's a hunter, whether the cat leads a sheltered life indoors, that does affect certainly the diseases, the injuries that they are potentially exposed to, and to some extent the specific preventive health care that they need in terms of treatments and immunizations. But I still would recommend, usually on an annual basis, bringing the cat in for a full physical exam. We can check for things that you would not be able to find at home, enlargement or irregularity of abdominal organs, which most cats will allow us to palpate and actually feel the kidneys and the liver and the spleen in there. We'll check all the lymph nodes, listen to the heart and lungs, pick up murmurs or irregular heartbeat that you would not be able to catch at home. And again, all of these, if we catch them early, are best treated at that stage. Keep in mind that all stages of a cat's life are accelerated relative to ours. They go through infancy, childhood, adolescence, and early adulthood by the time they're a year and a half old. And likewise, as they get older, their geriatric years are compressed. So a minimum of once a year. As they get older, sometimes twice a year with periodic blood testing, urinalysis. That way, hopefully, we can keep them as healthy and happy as possible for as long as we can.
We had him tested for feline viral leukemia, and there was the newer one on the street, which is called FIV, feline immune virus, which is like HIV for cats. And it turned out his blood test came back positive. He didn't have any symptoms of like the FIV or viral leukemia, but he does have terrible breath, and that supposedly is one of the symptoms of FIV. I mean, he eats like a pig, he loves food, he plays, he sleeps, he loves his mommy. He's very, very healthy. Fresh water twice a day, and I get him a really good dry food. But he loves fancy feasts, which is the McDonald's of cat food, and that's what he likes. He's blind in his right eye. They say that's part of the FIV too. It's like a lymphoma in the eye, but it's not dangerous. It's like, it's just kind of a glaucoma, like a glaucoma thing, but he can see perfectly well. I just don't like to let him on the fire escape because I think his depth perception might be a little messed up. The veterinarian that I talked to said there's nothing to be done about it. I mean, they could operate on him. The older they get, the more dangerous it is to put them under anesthesia because sometimes they won't wake up. So she said, just leave it alone because he can see perfectly well out of his other eye.
I have two cats. I have Toby and little Bear, and Bear likes to eat the palm fronds. It's not good for her. So I'm going to grow for her some cat grass. It's actually very healthy for them. Some cats really like cat grass. Some cats aren't that fond of it, but I think Bear might really like it. So I'm going to grow some cat grass. It's actually really, really easy. Just using regular potting soil. The deeper the pot, the stronger the crop. So that's a good reason to have like a deeper pot like this. Fill it about halfway. For this size pot, I'm going to use 2 tablespoons. So my soil with my 2 tablespoons. And then just cover it with a little more potting soil. So my seeds are now all nice and covered. Can't even see that they were over there. They're in there. And then we have to water. Nice and drenched. In about 4 days, I'm going to see some little sprouts. Put it next to the kitty food so they know this is for them. It will encourage them to eat it. Not all cats like cat grass. My cat Toby doesn't like cat grass. He completely ignores it.
The ear interior is shaped like an L, and the eardrum is way inside, so it's pretty much impossible to hurt the eardrum with a Q-tip by putting it in there, but you don't want to go too deep. Cats get ear mites by a little bug jumping in the ear and propagating in there. He's got very dirty ears. Oh my goodness. I think he has ear mites. This is ear mites, a black crusty material. Indoor cats can get it too. So what I'm going to do is clean out as much of this mess so when I put the ear mite medicine in, it goes down all the way. Sometimes with ear mites, only one ear will have them. All right, let's clean this out. Look. Ear mites. I check the ears at least once a month. And that's not enough. Now we're going to put the ear mite medicine in. Shake it up. Then I'll put some in, just a few drops. Okay, now hold the head and rub the ear down into the canal. Rub it down there. Rub it down. And then after I do this for a few more seconds, we're going to let him shake his head and shake out some of that mess.
How do I know if my cat's sick?
People often tell me my job must be more difficult than a physician because my patients can't tell me what's wrong or where it hurts. In fact, it's sometimes much more difficult than that because they can't even tell me or won't even tell me they're sick. This is especially true of cats. As anyone who's lived with cats knows, they are very much wild animals despite having lived in human company for thousands of years. And in the wild, to show your weakness is dangerous. This presents two problems for us. First of all, as I indicated, cats often don't show their owners that they're sick at all. So by the time somebody realizes the cat is ill, it's sometimes very sick. Second problem, which arises because they are brought here for examination, is by the time a cat does arrive on the exam table, he's been put in a cat carrier, bounced around in a car, taken out by a stranger, put in a strange place under bright lights, and they're poked and prodded, and their adrenaline levels are as high as they can get. When stressed, cats will hide their symptoms, and a cat that's been listless and lethargic and hiding at home comes into the exam room and is alert and attentive, walking around, showing absolutely no signs that it's not feeling well, goes back home and falls asleep in the corner again. Likewise, a cat that's been limping at home, having trouble walking, will come in here, jump on the table, walk around on all four legs, and then go back home again and start limping. Okay, let's bring your kitty in, we'll have a look. Given these considerations of feline behavior, it becomes all the more important to try and recognize early signs at home. Some symptoms obviously are not subtle at all. Cats vomit. Cats actually vomit for a lot of reasons. It's a very non-specific sign. Occasional vomiting is not unusual, but persistent or projectile vomiting certainly can indicate serious disease, heart disease, kidney disease, intestinal obstructions, even cancer in some cases. Diarrhea, not uncommon, especially in cats that dine out. But if it's persistent, certainly if there's blood in it, then it should be checked. Remember to pay some attention to the feet and nails. Cats normally wear down their toenails pretty well, but sometimes if they don't wear properly, especially cats with extra toes, the nails can curve right around and start digging into the pads. When that gets really deep, of course, they'll start limping. But in the early stages, it may still be painful, but the cat is not showing the signs. Other things to look for on the feet are changes in color. This is also like the gums. This is a good place to look to see if they're nice and pink. Of course, if cats have black pads, that doesn't help you. The temperature of the pads. If one or another foot feels cold compared to the others, that might be a sign that the circulation is not good. Pay attention to your cat's water consumption. A sudden increase in thirst may be an early sign of kidney failure, diabetes, sometimes less serious disease, but always worth investigating. And their urinary behavior is important. Even if it's not a larger volume, if the cat is urinating more frequently or straining or certainly passing blood, those are all reasons the cat should be examined and obviously have a urine analysis done as well. If the cat is not urinating at all, that's serious. If you don't see any urine being passed, unless the cat is urinating somewhere else in the house, that could be a serious sign of either kidney shutdown or, in the case of a male cat, could be urethral obstruction. And either one of those is potentially life-threatening and needs immediate attention. She likes her chin scratched. Poor oxygenation, which can be the result of respiratory or heart disease, will often cause the gums to look purplish or even bluish if the cat is in extreme distress. Jaundice is a symptom of several diseases, including certain forms of liver disease and breakdown of blood cells in the circulation. That will make the cat's mucous membranes look yellow. Sometimes you can see that looking at the whites of the eyes. Often in cats, the first time you'll see it is on the roof of the mouth. If the gums are inflamed due to dental disease or infection in the mouth, the gums will look redder than normal. And you combine that extra redness with loss of redness from anemia or some other cause, and the gums might actually look a normal pink color. So you have to put it all together. Finally, pay attention to the cat's general behavior. Sometimes they will show you signs there that they're not feeling well. A loss of interest in grooming is one of the first signs with some cats that they just aren't interested in taking care of themselves. And you see nonspecific signs like that, it gets your attention to look further. Most cats are excellent sleepers, which makes trying to determine if they're sleeping more than usual quite a challenge sometimes. If there are changes in the sleep pattern, sleeping in unusual places, if the cat is difficult to arouse, if the cat is not keeping to its normal routine, waking up from its naps when it knows it's mealtime, those are all signs that something's bothering it and might need further investigation. Likewise, if its social life has changed, if it's no longer interested in being with people, sitting on your lap, sleeping in the bed, or if it's not interacting the way it normally does with other cats in the household, those are all signs that you should look further. A valuable indicator of a cat's health is the color of its gums. Now normally if there's no pigment, they should be nice and pink, and you blanch the color and in about a second it comes back. Now if that capillary refill time, the time it takes for the blood to get back into the small vessels, is prolonged, that can indicate that the blood pressure is low and the cat's circulation is weak. If the gums are pale in general, that also can be a sign of poor circulation. Pale gums, especially if they're extremely pale, can be a sign that the cat is anemic. Some of the nonspecific signs to look out for are loss of appetite, decreased appetite, or less commonly, markedly increased appetite. And it's also important to differentiate between lack of interest in food and difficulty eating. A cat that's having trouble eating that wants to eat sometimes has trouble with the mouth, a loose tooth, infected roots, foreign body, a piece of bone or splinter in the mouth. Other signs of that might be unusually bad breath. When we're looking at her ears, one obvious sign is just the color. The skin should be nice pale pink. If it's red, that's usually a sign of inflammation, sometimes due to infection, sometimes due to allergy. The ear should be clean. You shouldn't see a lot of black or gray or yellow buildup in there. And there really should be no odor. Any of those would be signs, even if the cat's not showing discomfort. Some cats don't scratch or shake their head when the ears are infected. Certainly with ear mites, they're usually very itchy. But with some conditions, the cat doesn't show any signs unless you go looking for it. Cats normally have a lot of elasticity in their skin. If they're very skinny and they don't have any body fat, will have loss of elasticity. But when you pinch the scruff and it just stands up there, that may be a sign of dehydration. And in the very early stages of dehydration, you won't notice that. But if you pinch the neck and the skin stands up like that, the cat should be evaluated. I should just emphasize, never ever give the cats over-the-counter medications, aspirin, acetaminophen, or Tylenol, ibuprofen, or Advil. Those drugs can be extremely toxic, even lethal, with a single dose. Among the things we look at with respect to the skin and the coat is a nice, shiny coat, smooth, shows she's been grooming herself. Oftentimes cats that are sick, the coat is spiky and dull. Fever, an important sign in cats, also nonspecific, goes along with a lot of different conditions, infections and others. But you cannot detect a fever without a thermometer. And not surprisingly, most cats don't take too well to the rectal thermometer. Cats often will have normally a cold, wet nose, but the fact that it's dry or a little warmer does not mean they have a fever. In fact, some cats with a fever will actually feel cold, especially their ears, because they're trying to conserve heat to the body core, and the extremities, the outer part of the body, will actually feel cold. A cat with inflamed skin will often feel warm just because of the increased blood supply to the surface of the body. Remember, the normal body temperature for a cat is a couple of degrees above ours, 101, 102, 102.5. So if the skin is inflamed and the blood supply is close to the surface, they will feel hot. But again, that's normal temperature for a cat. Other fairly obvious signs are coughing and sneezing. Sneezing in cats oftentimes is due to upper respiratory viruses, like when we get a cold, and usually not serious, but sometimes they can develop secondary infections, in which case the sneeze is often accompanied by a heavy nasal discharge, loss of appetite, lethargy, signs of a fever, and so on. Other causes of sneezing would be foreign bodies, like a blade of grass in the nostril, sometimes allergies, or even nasal tumors. It's not unusual for me to examine a cat with labored, difficult breathing, and the history I get is that the cat was perfectly normal 24 hours ago. Well, we'll go ahead and take a chest x-ray of this cat and be amazed that the cat is even breathing at all. There's such extensive disease in the lungs. The reason is, again, the cats compensate. They gradually reduce their activity. They're moving much less. They're conserving their strength. And you just don't notice at that point that the cat is really having trouble breathing. And then they just reach a point where there's just not enough oxygen getting to the body. And the cat is straining and struggling. And one of the signs of significant respiratory distress is open mouth breathing. Cats normally breathe through their nose with the mouth closed. And if they're breathing with the mouth open, panting, then clearly something is wrong inside. This, of course, is far from an exhaustive list of everything you can look for with the cats at home. But I hope it does give you some idea of things to look for that might help you catch problems in the early stage. Obviously, the sooner you catch things, the easier they are to treat, the better the prognosis, and the less intrusive and invasive the treatments are likely to be for the cat. I really should emphasize that cats are healthy animals. Their evolution has created a healthy, strong animal, very self-reliant and resourceful. I don't want to discourage people from being attentive, but let's strike a sensible balance, because cats don't like excessive poking and prodding if they're feeling well. Case in point.
I'm checking her eyes to see if she looks, the eyes look good. Her breath is very bad. I'm just looking at her mouth. And her ears are cool. Her paw pads are cool. I think you're all right.
I've had cats my whole life, but he was the only cat that really liked dry cat food. All the other cats really liked the canned cat food. At some point I realized he is really packing on the pounds. He got quite heavy. So I did take him to get his teeth cleaned, and when I went to pick him up, there was this big bag of special cat food for diabetic cats, and I went, oh, that's ours. I just know it. And they couldn't clean his teeth because, you know, they checked his urine, and that's how I found out he was diabetic. But I knew it, you know, I mean, I just had a sense that that's what was wrong. So if you have a cat that likes dry cat food, the recommendation is to get kitten chow because it has more protein than the other dry cat foods. It's more protein and fat and less carbohydrate. I think the cat foods are better now, but some of them just have a high carbohydrate content. So it's like cookies. And that's why they'll just eat them and eat them and eat them. It will tell you exactly how much protein, how much fat, carbohydrate, fiber. So you want to get one that's got a really high protein number. I did notice that he was drinking a lot of water and that he seemed to be urinating a lot. And that is one of the things to watch for. If they have a weight gain and if they start drinking a lot of water and if they start really urinating heavily, get them checked because the sooner you can correct their diet, you know, you can probably stave off the diabetes. He's been diabetic now for about 3 years and he gets insulin shots twice a day. This is human insulin.
Okay.
Okay? So this runs me about $35 to $40 a month for this little bottle.
Wow.
And we only use about half of it because it loses efficacy after about a month.
Right.
So it has to go in the refrigerator, okay? So when you come, take it out of the refrigerator and just let it warm up a little bit and,
Okay.
Feed them. And while Sylvester's eating, it's going to be easier to give him a shot because he's going to be
While he's
occupied,
eating, okay.
So the first thing that you do is you roll the bottle. That just mixes it up.
Okay.
And it warms it up a little bit
Okay.
too. So you just roll it, okay? You're going to break this little cap off, exposing the plunger. You insert the needle into that little white spongy area, and then you tip it upside down. There are markings, and you pull down. You let the insulin come into the syringe, and then you just push it back up until it gets to 5 units. And that's what
all.
he gets.
Okay.
One of these twice a day.
One of those, okay.
12 hours in between,
Right.
5 units. And for some reason you're not sure that it went in, sometimes the needle will bend. Don't give him another shot.
Right.
Just wait till the next time, because if you're not sure you gave him the shot and he did get the insulin and you give him another,
that's gonna
it's too much.
affect him.
So this is Sylvester. He's a putty cat. So you kind of come up and you scratch him and you talk to him a little, and you usually try to do this while he's eating because then
him a
he's
little at ease.
yeah. And then you just come back here and you just get this nice big fold of skin.
Okay.
Just come in and you just go. So love your cats and take good care of them, and don't let them eat whatever they want because they don't know what's good for them.